Have you ever wondered, does acupuncture even work? If it does work, then how does it work? Let's briefly look at how acupuncture began. Thousands of years ago, when people in China were seeking treatment for pain, they would experiment by pushing on pressure points around the body. Needles were then made out of bones and bamboo and used to puncture these points to see if that would fix them. Through trial and error, a map was eventually developed to show points all over the body treating different issues. In the early 1800s, this medicine traveled from China to the US. When people started to hear words like qi and meridians in the body, many were not receptive. However, the ones who decided to try acupuncture treatment would see that it really worked. There was no research behind how this worked, so people began to wonder, could this be a placebo effect? This question led many researchers around the world to study if acupuncture could be explained through modern medicine. After compiling hundreds of current up-to-date published papers, we now have a possible explanation. Acupuncture has always been very popular for its ability to provide pain relief. When someone steps on a nail or pulls a muscle, there will be an activation on a nerve that will send a signal to the spinal cord where the chemical released is substance P. Substance P then activates a nerve in the spinal cord to send the pain signal up to the brain. Now let's look at the explanation on how acupuncture can help. When the needle is punctured through the surface of the skin into an acupuncture point, or acupoint for short, the needle will have to go through multiple layers of tissue before it hits the muscle. The most important and most ignored layer would be the fascia. Fascia is a band of dense connective tissue made of collagen that is located beneath the skin. Similar to saran wrapping, it attaches, stabilizes, encloses, and separates muscles, nerves, blood vessels, and internal organs. So in other words, no fascia, no form. This fascial surface has tiny holes with free endings of a nerve, artery, and vein forming a triad. Pain exists when these triads become strangled by collagen. Surgeons discovered that once the collagen becomes microsurgically de-strangled, the patient would have significant improvement on pain. The de-strangling will initiate the release of endorphins from nearby nerves, which will block the release of substance P in the spinal cord, leading to little or no pain perception in the brain. Research in Germany showed that these fascial holes are 82% identical with 361 classical acupoints. Not only has fascia been proven to be involved with pain, but it also has been shown to be involved with maintaining health. Having a healthy body means having strong white blood cells. Specific types of white blood cells called mast cells are located nearby nerves underneath the fascial holes. When the needle punctures an acupoint and is manipulated by twisting and thrusting, the fascial collagen deforms. This action creates little sparks of electricity similar to a spark seen on a lighter, known as piezoelectricity or pressure electricity. This electricity will activate nerves located under the fascial holes to release substance P, which act on mast cells for other effects such as blood pressure, inflammation, mood, anxiety, and cell growth for wound healing. Once bound to the mast cells, they will degranulate and release histamine, heparin, and neurokinin A. These substances will then interact on surrounding nerves, which will cause an electrical shock sensation, where in acupuncture it is called de qi, or to obtain qi. The substances will then travel through the surrounding nerves to the spinal cord to have activation in the brain. The insular cortex is a major region of the brain involved in regulating the autonomic functions in your body, producing a sympathetic or parasympathetic response. The sympathetic function produces effects to aid in a fight-versus-flight situation, such as increasing glucose for energy, increasing heart rate, or preventing digestion, preparing your body for exercise. The parasympathetic function is designed to prepare you for resting and digesting. You will see effects such as increasing gastric acid secretion, decreasing heart rate, or increasing gut movement. This is a proposed mechanism behind acupuncture treatments not involved with pain, but maybe for overall health maintenance. What is mentioned here is just up-to-date research. There is still so much more to look into greater detail regarding how acupuncture works in your body. This video was created as a first step towards educating patients on what might be occurring in the body from evidence-based research around the world. Ask your acupuncturist today about the traditional Chinese theories and make your own connections.